YouTube channel phoenixphysio. Please subscribe. Hello physios. Today's topic is a shoulder dislocations. Okay, the shoulder joint is the synovial variety of a ball and socket joints. Okay, this is the most common in the human body to dislocate. It occurs most commonly in adults and rare in children's. Okay, the anterior dislocation is much more common than the posterior dislocations. Okay, so here is a shoulder anatomy that include the clavicle, acromioclavicular ligament, acromioclavicular joint, acromion process, head of humerus, coracoid process, and scapula. It may be the multiple directional. Shoulder joint is dislocated in the multiple direction like anterior dislocation, inferior dislocation, or posterior dislocation, where it is called the multidirectional instability (MDI). Now we'll see the pathoanatomy. The classification of shoulder joint is mainly three types, that is the anterior dislocation, posterior dislocation, and inferior dislocation. First we will see the anterior dislocation. There are three subtype of anterior dislocation, that are preglenoid, subcoracoid, and subclavicular. Here we can see into the picture that this is the anterior dislocation normal, and the infraclavicular, coracoid, and preglenoid. Okay, into the anterior dislocation. In this injury, the head of humerus comes out of the glenoid cavity and lies anteriorly. Okay, it may be the further classified into the subtype depending on the position of the dislocation of the head. Okay, as we see into the picture, the preglenoid, the head is laid in front of the glenoid cavity. Okay, and the subcoracoid, the head is laid below the coracoid process. This is the most common type of dislocation. Okay, and the subclavicular, the subclavicular is the head lies below the clavicle, as we see into the picture. Repeating again, the infraclavicular, subcoracoid, and preglenoid. Okay, so now the posterior dislocation. The posterior dislocation, in this injury, the head of humerus comes to the posteriorly behind the glenoid. Okay, and the inferior dislocation, this is the rare type where the head of cum lies the subglenoid positions, also called the laxatio erecta. Okay, here are the some pictures I have make into the PDF, that are these are the anterior dislocation, this is the posterior dislocation, and these are the anterior dislocations. Okay, we can see into the X-ray. The X-ray is very useful into the diagnosis. Now the diagnosis, when the patient come to the clinic, that's the patient complaints, that are the patients enter the casually with his shoulder abducted and elbow supported with opposite hand. There is a history of a fallen on the outstretched hand and the followed by the pain and instability to move the shoulder. Okay, there may be the history of the similar episodes in the past. Now on examination, the patient keep his arm in abducted and the normal round counter of the shoulder joint. This is the most common because flattenated. On careful inspection, it may be the notice the fullness below the clavicle due to the displaced the head. It can be felt by the rotating arm. When we rotate the arm, then we can feel on the deltoid side. Okay, now we will see the treatment. The treatment is the acute dislocation reduction under the sedation and the general anesthesia, followed by the immobilization of the shoulder cast arm bandage for the 3 weeks. After the bandage removing, the shoulder exercise are begin. Okay, there are some techniques to reduce the shoulder dislocation, that are the Kocher's maneuver. Okay, this is the most common use. Okay, let's see the Kocher's maneuvers. Okay, there are some tips for the Kocher's maneuver, that are the traction, external rotation, abduction, and the internal rotations. So first we will see the traction. The traction with elbow flexioned to a right angle, steady traction is applied to the along with the long edges of the humerus. Okay, in the external rotation, the arm is externally rotated. And the abduction, at the external rotation, arm abducted by the carrying the elbow across the body towards the midline. okay, and the internal rotation, the arm is rotated internally, so the hand falls across the position of shoulder. The complications are divided into the early and the late. Okay, so early complications are injury nerve to the axillary nerve. The axillary nerve is mostly injured at and the paralysis of the deltoid muscle with a small area of anesthesia over the lateral aspect of shoulders. Okay, and the late complication, the shoulder is the commonest joint to undergo the recurrent dislocation. The result from the following cases that are the anatomically unstable joint, that's called into the Marfan syndrome, and the inadequate healing after the first dislocation, and the epileptic patients. Okay, so it was the shoulder dislocation all about. Okay, but one thing that I have forgot to tell you, that the about this, the coach's manual is very important, but if you read this, then you will do not understand, but if you do practical with it, then you will understand. First give a traction, then external rotation, adduction, and then internal rotation. This is the one of the most famous non-operative method for the shoulder dislocations. Thanks for watching the video. Please share and subscribe. If you want to PDF, then link in description.